What can be done to repair my neck facelift? I'm 72. In June 2012, I had a neck and lower facelift and liposuction on the neck. After, there was a lumpy area under my chin. My doctor said to wait 9 months. My lips were stretched, but within 2 weeks, that had improved. However, it's continued to come undone. My jowls, lines from nose and mouth, neck wrinkles are reappearing, about 50% undone, and under chin is much worse. 2 plastic surgeons said I had good skin elasticity. What can be done? An in-office procedure? Should I trust the same doctor? Help.
Thank you for your question. You are asking about can the situation you're in be corrected and can it be done as an in-office procedure? Well, the situation you have appears to be where you had liposuction and you had lifting done, but there appears to be some regression and collection of extra skin below the jawline. And it clearly needs some kind of revision in order for you to look as good as you appear to look immediately after surgery. There is unfortunately some cases where there's a lot of regression, and it depends a lot on factors such as skin elasticity. So as far as an in-office procedure, I'd have to say that what matters decision you make is based on really the surgeon who did the procedure and what kind of situation it was when you had it. So let me explain. Essentially, if you had the procedure under general anesthesia, then most likely your surgeon is comfortable doing this kind of surgery under general anesthesia. And if you had under local anesthesia with sedation, well then fine, your surgeon is more comfortable doing it that way. I can tell you in my practice, I do all my facelifts and neck lifts under local anesthesia with sedation. That means getting a little IV and getting some liquid Valium and propofol and being able to just be relaxed throughout the procedure, and my patients recover pretty nicely that way. So as far as in-office is concerned, in my practice, we have our own facility within our office. So technically everything we do is an in-office procedure. I would say that if your surgeon, again, if there's a certain amount of laxity and your surgeon feels comfortable with doing this under local anesthesia and feels like this can be done as an in-office procedure, well, that's fine. You see, what we can't do in our assessment or opinions that you submit with these questions is do a physical exam. And a critically important part of making a decision about the level of surgery that's necessary or the extensiveness of the procedure is the actual simple movement of just lifting the skin. And when I lift the skin, I look at the directions. And so if I need to move very high and there's a lot of skin to move, then it means that my incision in the temple has to go up a little higher in order to move the skin in a way so that there's no pleating and no excess, or there's just somewhere for all that skin to go. So I would probably say that your procedure, based on just the photos alone, in my practice I would do under local anesthesia with sedation. And that's basically for our practice an in-office procedure. So if your doctor did this under general anesthesia, you just have to have a clear understanding from your doctor what the comfort level is, what the extent of the surgery is, and then make a decision. And again, and another thing I also suggest whenever people consider revision surgery, with something like facelifting, if their doctor has been doing a lot of facelifts, then most likely it's your first doctor that should be doing the revision or enhancement of the surgery, since they're already familiar with you and they're familiar with the elasticity and the quality of the skin and what they can expect. So I think that if all those things fit right for you, feel right for you, then you can go ahead and proceed. So I hope that was helpful, and thank you for your question.